Hello everyone, I am Dr. Ganesh Mhetras, consultant nephrologist at Manipal Hospital, Kharadi and Summer Clinic, Kharadi, Pune. Today I am going to discuss about topic called as edema or generally labeled as swelling in detail. What are the causes, how does it presents, what are the disease underlying it can have, and shortly in treatment part. Basically, edema is swelling actually. It can be divided into two parts. Swelling can be generalized, like it can involve the legs, abdomen, and face as well. Also, there can be localized swelling, like affecting the individual upper limb, lower limb. So basically, swelling can be divided into two parts: systemic swelling and local swelling. Now, local swelling can be part of because of the local injury, local infection like cellulitis, or because of the block clots in the blood vessel causing deep vein thrombosis, or any obstruction to lymphatic drainage, where the swelling will be confined to the particular area of the part of the body where it is involved, like lower limb or upper limb. While coming to the more detailed discussion of the edema that is systemic in nature, that can involve all over the body, that has serious underlying medical conditions that need to be diagnosed and treated earlier to prevent the complications. Now, when the swelling occurs, it can start in the form of swelling over the feet, something called as ankle edema. It can gradually worsen and affect the thighs and calf. In latter part, it can involve the abdomen, causing distension of abdomen, and afterward it can cause swelling over the face, causing facial puffiness. In severe form of edema, it can involve the lungs, something called as pulmonary edema, leading to breathlessness. There can be other edema like cerebral edema, macular edema. Those will be localized kind of edema. In cerebral edema, there is a swelling of the brain following any stroke or head injury. In cases of eye diseases, there can be swelling of the eye, it's called as macular edema. We will discuss about the causes of the edema. Now, what are the medical diseases that can present as a swelling over feet or swelling over face? It is important to identify this underlying disease because there can be different variety of causes that can cause same presentation. So, majorly affected diseases are like diseases involving the heart, kidney, liver. This can present as a swelling over feet, face, or distension of abdomen. Coming to the heart diseases are like disease of heart muscle, something called as cardiomyopathy, or because of the blockage of the coronary artery leading to ischemic cardiomyopathy, they can lead to the swelling. In certain stages, the swelling can involve the lungs, something called as pulmonary edema. In this case, patient can have breathlessness, coughing, blood in the sputum. There will be increase in heart rate, pulse rate. Pulmonary edema is a medical emergency requiring immediate attention. If attention is not given, it can result into life-threatening complications. Now, coming to the kidney diseases, often kidney diseases will not have much symptoms in early stage. The symptoms can be vague and non-specific in nature. One of the symptoms that is common is swelling over the feet, or something called as ankle edema, pedal edema. In early stages, this symptom may not be persistent. It can be on and off, and many times it is neglected actually. As disease progresses, the swelling can worsen. It can involve other part of the body like abdomen, leading to distension of abdomen. It can cause swelling around eyes or facial puffiness, and also in severe form it can involve the lungs, causing pulmonary edema. So many times it is very important to identify these symptoms and need to the evaluation. Another disease that can cause such a type of symptoms is liver diseases, something called as liver cirrhosis, maybe because of alcoholism or any other medical disease. Even liver cirrhosis also you can get swelling or edema. In this diseases, there can be distension of abdomen, something called as ascites. And as liver disease worsens, it can lead to the pedal edema, facial puffiness, or sometimes edema as well. So major organs diseases that can lead to edema are the cardiac, that is heart disease, kidney disease, and liver disease. There can be other diseases also where there can be edema, especially the patients who are having poor appetite, sustained malnutrition, where patient will have low albumin in their body, and this can also lead to the systemic swelling, something called as anasarca or edema. Now we have to for diagnosis you need to consult a physician and get done routine tests that includes ECG to do echo for the heart diseases. For kidney function to assess, you need to do urine test, blood test like serum creatinine and ultrasound kidney. For liver disease, you have to do liver function test as well as ultrasound kidney diseases. Coming to the treatment part of edema, it depends on the underlying cause. Like the edema is localized to one part of the body, like one hand or one lower limb. We have to identify the cause. If it is due to trauma or some injury, the elevation of the limb, anti-inflammatory drugs, or cold ice packing can relieve the edema. If it is due to underlying other causes like blockage of the blood vessel, something called as deep venous thrombosis, The treatment will be leg elevation and giving the drugs that can thin out this blood clots, called something called as anticoagulation. There can be another cause of localized edema, something called as lymphedema, where there is a obstruction of the lymphatic system, maybe because of the infection or surgery, where localized edema will be there, and that will need sometimes radiotherapy or surgery. Now, coming to the systemic edema due to heart disease, kidney disease, liver cirrhosis, where there will be fluid retention that causes edema. The treatment is usually fluid restriction and giving certain medicines or pills that will remove this excess body water and salt from the body. These drugs are called as diuretics. So fluid restriction, diuretics help relieve the swelling, that will reduce the edema feet, distension of abdomen, and in case of edema, relieve the breathing difficulty. Now, edema can be seen normally as well, especially in pregnancy. Mild edema is common thing, did not be manifestation of underlying medical diseases. There can be certain drugs called as steroids. If taken in a over a period of time, they can cause edema in the form of swelling over the feet and swelling over the face. And in case of certain patients who are consume excess amount of salt and water, they also can manifest as a edema, fit or weight gain. Why it is important to identify this underlying medical diseases, that many times once diseases are advanced, it is difficult to reverse this pathology, especially in kidney diseases. As mentioned earlier, kidney diseases in early part will not have very specific signs and symptoms like other organs actually. So if somebody is having long-standing medical condition like hypertension, diabetes, and if he develops swelling over the feet, even it is mild, something called as ankle edema, it is important that you should undergo screening test to diagnose kidney function in the form of blood test, urine test, sonography, and this will diagnose the underlying kidney disease, and that can be treated appropriately. Because once this kidney disease is advanced, the reversal becomes difficult. In early stages, early diagnosis can prevent a lot of complications. So edema, that is swelling over the feet, ankle edema, it is a important manifestation of underlying disease that can have serious implications. Commonly affected organs that manifest as edema are kidney, heart, and liver. In case of kidney disease, very important to diagnose earlier so that we can prevent the long-term complications of kidney disease. Thank you.